So my name is Amanda Burgess, and I want to also introduce myself and kind of my position in this space and movement. So I am a visibly a white, a middle-class woman with a bachelor's and master's degree who's been privileged and supported and encouraged by my family to pursue my dreams beyond being a wife and mother. Which has also led me to being involved with working at a leading public health institution at Johns Hopkins University. And that's how I kind of got into this work, supporting ICFP and a power shifting conversation that we hosted there. And I will turn to my other co-leader here.
Hi everyone, my name is Goodness Oge Ode. I am a young woman who is from Nigeria. So I'm from Yala in Cross River State, Nigeria. And I have a bachelor's degree in public health from the University of Calabar in Nigeria. Over the years, I have been very committed to work around promoting sexual reproductive health and rights at the center of it all, ensuring that there's meaningful youth engagement in how we design this, policy advocacy, multi-stakeholders engagement, and some of these had also led me to be involved in some research. So last year, I got involved as ICFP. I was selected actually as an ICFP Youth Trailblazer awardee, and I attended ICFP 2022. And with my engagement, I also got to learn about the Power Shifting Pre-Conference. And what was exciting for me as an individual and the work I do is that in many respects, I have seen how power has been instrumental to my experiences, assessing my health needs and my community when we push for health equity in research, and saying how do we have the voices of African researchers who are driving the research that affects our communities and how it translates to global health. So I found engagement with the Power Shifting Subcommittee very interesting, and I got more involved, and here we are at PAA having this conversation. Thank you.
So we wanted to start with a little bit of framing on the how we got to where we are, and a few reflections on the history of demography and kind of where the field got its start. So as most of this group probably knows already, the initial impetus behind population research in the social sciences was to really send researchers out to other countries and cultures to study disease and populations in order to colonize them. So it was generally motivated to protect and benefit the people from high-income countries where the researchers came from, mostly, not necessarily the communities themselves who were being studied. And this work was very extractive in nature. In the 1950s, there was a growing trend to kind of work more collaboratively through partnerships between organizations in high-income countries and those in low and middle-income countries. But there was still a big inequity within those partnerships in terms of the power and how that's played out. And overall, there's still a lot more higher income countries that are funding research in low and middle income countries. At the same time, we've seen research and training institutions in high income countries kind of dominating the scene, which creates a system and a structure that disadvantages institutions in low and middle income countries from competing for research funding, from attracting and retaining top students, and providing comparable job prospects within those countries for their students when they come back. So while some of these efforts to seed research institutions in low and middle income countries have aimed to close the gap, we still see the inequity persisting in the field as a whole. And I think in the last point I want to make is that international donors have been more vocal in supporting a shift in strategies away from funding institutions in high-income countries towards funding local institutions in low and middle-income countries directly. And in the Paris Declaration for Aid Effectiveness in 2005 and the 2008 Accra Agenda for Action, these locally driven activities were the centerpiece of a new global assistance model. So while we're seeing this trend, we're still a little far away from sort of seeing what that actually looks like in practice. And that's kind of the broad scale overview of the history of kind of how we've gotten to this point. And I'm going to turn it to Goodness, who's going to tell us a little bit about kind of what's happening in the power shifting world overall, and the conversations that we've been happening both reflecting on what the conversation that we had at ICFP in Thailand in November, and then a few other pieces that she's been a part of.
All right, thank you so much. So what's really happening in recent conversations that I've been involved in and then listening in with the team? To begin with, at ICFP 2022, we had the Power Shifting to Advance Global Health Equity pre-conference, and some of what stood out for us is how there's an importance to look a lot on shared trust and shared values, how we have a mutual respect for each other. And at the same time, when we come to the equity table, there's a need to listen more to one another. There's a need for self-reflections and also on learning, because that can be something quite difficult. And although the focus was on sexual reproductive health and rights and the different perspectives to this at ICFP, we're also looking broadly in global health and say, how do we have true collaborations and partnership? Then, most recently, I was opportune to speak at the African Health Agenda International Conference in Kigali. That was last month. And that conversation was one Afrocentric conversation, in the sense that as African leaders and stakeholders, we had researchers, policy makers, young people across different fields working around the African health agenda. Truthfully, we agreed that it's important for Africans to design the African health agenda in terms of policy, implementation, research, that is for Africans and done with Africans. But then we also have to build that sense of responsibility. We also have to be more accountable. And when we demand for equal power or share power, do we have that capacity to hold on to those power? And are we going to be transparent and also accountable in our venture? We also had a very interesting perspective on saying that over the years, we've seen how aid and support gotten from high-income countries, or say the global north as we would call it, has made a difference in the African continent and maybe shaped the African agenda. And then we have this conversation on decolonizing, but how are we utilizing the resources we have to achieve that African autonomy or the new public health order we desire? How are we, again, holding ourselves more accountable to this? In addition, we have the African Fairness Initiative domains, which it's an interesting initiative that is pushing this conversation on the need for collaboration, partnership when we look at research. And this is really critical to say in research integrity, right? Beyond ensuring that the process of conducting this research has the ethical procedure is observed. How do we ensure that there is fairness of opportunity? So fairness of opportunity is looking at the ability to compete for funding, and also like in terms of equal access and a level playing ground for everyone. And at the same time, how is setting the research priorities that fit into the local context, right? Take, for example, you want to conduct a research in Kenya, and then you set the agenda in Geneva, and then you go down to the field, but you don't get the experience or the voice of the local researchers, local in the sense that maybe the data collectors or maybe the research institutions, and say, how does this fit in? Can this work? Or what's really the reality? So instead of a top-bottom approach, it should be a bottom-top approach, right? And then there should be equity in that approach. Then fairness of process is one critical point the Research Fairness Initiative is pushing for, and this process is from the point of capacity, data ownership, storage, access and use, access to the full budget, mentorship, salary support for the research. So everything, like we can't just assume that, oh, they should know what to do, or we are bringing the best practices or the guideline. How are we designing all this process with the community or with the country or the population we are working with? Then fairness of outcome, and this is looking at intellectual property innovation, authorship, publications, who benefits from this data? Do we complete the feedback loop when we are conducting research? Do these communities understand and get the outcome of this research, and how is it useful in their context? So these are some of the interesting conversation that has been going on around power shifting in the research community.
So today, we're going to dig into kind of what it would mean to decolonize knowledge and shift power in research collaborations and partnerships. And so in this context, we're thinking of decolonizing knowledge as knowledge production. So for example, who decides what goes into a survey or an instrument, to knowledge legitimization. So what's included in university curricula and training, what data are accepted at the country level, versus knowledge use. So who's benefiting from it, who's listed in what order on publications, and how is it being used to affect change. So we're first going to hear from some colleagues who sit in the funder and recipient spaces about how they've experienced power shifting in action. And then we're going to explore some opportunities and challenges to doing this work together. After that, we're going to take a little bit of a break to caffeinate. We've got coffee and tea outside. And then come back together to hear from Dr. Jacques Emina from the University of Kinshasa and Dr. Thomas Leviste from Tulane University, talk about what power shifting has looked like for both of them in partnership. And we will come back together at the end to talk a bit more about what doing this work might look like before we break for the day on this conversation. The first thing we were going to do is a Slido poll. So for those that have not done a Slido before, you will need your phone. Now the question is if your research work was an ice cream flavor, what ice cream flavor would it be? Our next question is, how would you describe your role in relation to research in 1 to 2 words? So would you describe yourself as a scientist, a collaborator, a data analyst, donor, policy expert, advocate? There's any number of options. I, for one, would say I'm an advocate. All right, it looks like my word cloud is working.
Yeah.
There we go. All right. Got some policy experts in the room, some scientists, a few collaborators. Ooh, scientist collaborator. I think a lot of us see ourselves in a number of different positions. As it relates to research. And so I think one of the things that we wanted to do was keep this in mind as we go into the panel and as we start thinking about what actions we can all take. Because in all of these roles, there's an option to take actions to shift power. So we're going to turn it over to Phil and our panelists. So if our panelists could come up, that would be excellent.
All right, well, hi, everyone. I'm Phil Inglovich from Johns Hopkins University and PAA2023, or PMA as we're called now. And I'm thrilled to be the moderator for this session because this topic is certainly near and dear to my heart and certainly affects a lot of the work that I do these days. So our panelists, I think, are also perfectly suited to be here as well because I think they have considerable experience in power shifting and, how research collaboration has been successful in identifying common threads for what works and what are some of the barriers in facilitating this power shifting. So to start off, I'd like to ask each of our panelists to introduce themselves, maybe describe what their positionality is, as well as the organization they represent and their role in this space. So maybe we could start with Althea.
Hi, I'm Althea Anderson. I am a program officer at the William and Flora Hewlett Foundation in our Gender Equity and Governance program. I co-lead our work on global reproductive equity and women's economic empowerment. My positionality, I'm a Black feminist scholar, activist, and artist, born and raised in California and still here. I am trained as a researcher in the public health space. I have worked primarily in the African region. So conversations around research partnerships and equity are very near and dear to me. It's something I've been working on for 20 years. And now for the last almost 6 years, I have set within the philanthropic space. I work for a funder, the Hewlett Foundation, a private foundation that is on the development side of the philanthropic spectrum. And we are deepening our commitments to gender equity and racial justice internally and through our grant-making practices. So that is where I sit.
All right, thanks very much, Althea. It's great to have you with us. So next up, Apurva.
Hi, everybody. My name is Apurva Jadhav. I am a demographer, and I work at the United States Agency for International Development within the Office of Population and Reproductive Health in the Global Health Bureau. It's a lot of word salad, but I think each of those spaces represents positionality that I do want to acknowledge that, I work at an organization or agency that has contributed to a lot of the power imbalances historically, as well as what we're seeing today. In fact, our agency, as well as our office, was started in the 1960s, which was when the population bomb scares were rife. So I do want to acknowledge that and my role here, and accept that with humility and acknowledge that. I will also say that I am a Indian American feminist. I belong to the Dalit community, which is in the caste system, the lowest of the social classes. And, you know, I think in representing all of these different positionalities, I think it's they're sometimes at odds with each other, especially when you think of the personal versus the professional. But I think it's a reflection of so many of us that are balancing and juggling a lot of these different nuanced positionalities within the professional and private spaces that we occupy. I will, I think, say a little bit more about what USAID is doing when it comes to power shifting, but I do want to state that I work within the management teams of the Demographic and Health Surveys program, and I'm happy to provide some examples and questions for you all as we delve into research and power shifting today. Thanks.
Thanks very much, Puerva. Really appreciate your perspective. Chris?
Thank you so much, Phil, and thanks, Kelly, for inviting me. My name is Jean-Christophe Rusatira. I am originally from Rwanda. Relocated to the US 6 years ago. I'm trained as a physician, public health. I worked for Gates Institute for 4 years, and now I'm finishing my PhD at Johns Hopkins in public health, in population, family, and reproductive health. So I would say the way I position myself, definitely a scientist. I'm an advocate, and I'm also a social entrepreneur. And now I add that I'm also a founder, because I recently had to count how many things I've actually founded, especially in public health, and I realized it's quite a good number. I founded Healthy People Rwanda, which is a local NGO in Rwanda doing great work, you know, reproductive health, family planning, road safety. I was a co-founder for International Youth Alliance for Family Planning, which is also doing great work. I founded businesses, basically giving back to the community and also trying to make money. So all of that, that's where I fit. And I'm always engaged in public health discussion, development, and I recently led the development of the Demographic Dividend Effort Index, and that's the work that I will be focusing on today.
Great. Thanks very much, Chris. Really appreciate your considerable range of experiences, and I think you're perfect for this panel. Bernard?
Hello, everyone. My name is Bernard Onyango. I am from Kenya. I work for the African Institute for Development Policy, AFIDEP, which is an organization founded in 2010, and it's African-led. We have offices in Nairobi and Malawi, which is our headquarters. So I trained maybe a bit of some background. I'm a social demographer. I trained in demography at Brown University. So I did my master's and PhD at Brown University, and I think I'll circle back to that a little bit later on in our discussions. And so I'm a senior research and policy analyst, as well as also director for one of our projects that's funded by USAID, the BUILD project, building capacity for integrated FP, that's family planning and reproductive health, and population, environment, and development. So it's a bit of a mouthful, but just to point out that this project is probably, I think it's the first project funded by the Office of Population and Reproductive Health at USAID, that's led by an African, an African institution. So big global project, that is a global project. So the project covers both Africa and Asia, and at the moment we are focused on 4 countries, Kenya, Malawi, Cote d'Ivoire, and the Philippines. I guess I'll say more later, but I think just to say that I am very passionate, and my colleagues at AFIDEP are really passionate at in bridging the gap between evidence, policy, and practice. And so that's really the main reason that AFIDEP exists. Thank you.
All right, thanks very much, Bernard. And I think, as you just illustrated, AFIDEP is front and center in a lot of the discussions about power shifting. So I think it's great to have you with us, and can't wait to hear your thoughts. So to organize this session, I have some questions that I'm going to pose to the panelists. And I'm going to start with one that I personally think about quite a bit, in terms of the dynamics to consider in research power shifting. So things like who sets research priorities, who owns and collects the data and uses the data, and who benefits from research. So I think my first question to the panelists is, what do you think are some of the dynamics to consider along the research continuum when approaching power shifting? So anyone is welcome to go ahead and answer that question.
All right. So I'll go first, and I think for me the critical thing is to really address the question: what are we or what are we responding to, right? And I think this is important because it looks at who are the beneficiaries of what comes out of that research. And I'd like to think that, we are, as researchers, we ultimately focused on doing some public good. And so that question in power, in the research power shifting, I think is critical. As you've already said, in terms of context, the big question is always, are the research priorities aligned with the needs of the beneficiaries? And so I think that's really critical. And for someone working, so I've done a lot of work across the African continent, and meeting the different stakeholders, particularly policymakers. This is a question that is also very dear to them, and I must say that in a fair amount of them, a fair number of them, are at times really skeptical about whether the research priorities, the researchers actually responding to the needs of the people on the ground, as they say, or the local needs. And so this, for me, is a very important question for us to consider. And I think it's an area where we have to admit that in terms of, because the priorities also come with where is the funding coming from. And for sure, researchers, I'm sure all of you in the room are always keen as you're responding to any call for proposals to make sure that you understand the priorities of where the money is coming from. And so, in a sense, for researchers in Africa and people like myself and AFIDEP, what we are trying to do, yes, this is a recognition that we are still working with that, making sure that that you respond also to the priorities of funders. But importantly, what more can we do in also influencing the priorities of funders? So that is very critical for us. And so for us, in that power shifting, our engagement with with the different funders, also it's not just about waiting for their priorities, but ensuring that you have more focused engagement where you also influence what their priorities are, but also in a sense we sit to some extent as intermediaries between the funders and policymakers. And so we are not just trying to influence funders' priorities, but also engaging with the policymakers in the continent to ensure that we are also responding to their needs. Because what we hear from being on the ground is, yes, you can do great research, you can have good findings, good recommendations, but if they don't align with the needs of the policymakers, of the countries, of the local communities, then you might do great publications, but in terms of policy impact, it turns out to not. So I'll stop there for now. Thanks.
Great, thanks very much.
I think Bernard was quite exhausting in matter of list of the things that probably we do not necessarily prioritize when it comes to looking at research and programs. I think I would add maybe three elements. One critical aspect that I think, at least from my experience working in 6 countries, developing a demographic dividend effort index and working with national population councils, was that countries are at different stages, and what's available in one country may not necessarily be in the other country. And us going in, we pretty much had the idea that, okay, this is what we want to do. And when I say us, that was the Gates Institute. But we kind of had to really readjust because we realized that in some countries, maybe we could have worked with the National Population Council because they were in the right position to do the work we want to do. And in other places, we initially started engaging the university, then didn't work out, then looked for a civil society organization. But I think that was only possible because we had some flexibility with the funding that we had. We basically had to decide who to work with, basically to respond to a certain need. And having been a recipient of different grants, many grants won't allow you to do that. If you are based, let's say, in Kenya or in Uganda and you want to work with a certain organization, some organizations donors may want to have certain levels of clearance that we didn't have to get, which I personally think was really very helpful for us to do what we were able to do and engage locals. So the other, the second element is when we think of locals, how do we actually define the locals? So I think I would give an example. In many countries, if you are in sub-Saharan Africa, the people we may be talking to may not necessarily be the people who have that understanding of the local needs. And the reason I say that, of course, we have socioeconomic strata in the US or in Europe or where we have most in the developed countries, they are more defined. But in developing countries, those strata are also there. And I always say that you cannot know what happens in a farm if you've never been a farmer. And I think that's one of the challenges, that even if you wanted to make a move to make sure that you are responding to local needs, I think it's very important to try to find out who actually has that knowledge that I'm looking for to inform my program.
I think your last point was especially relevant. I think a lot of times we talk to local elites versus really designing programs and reflecting on who locals are. So thank you for that point. I think when it comes to the research continuum, Phil, when you posed it, I think each element is equally important. And I think having this conversation focused on research specifically and power shifting and decolonization is so important, because sometimes you feel a little bit lost in all the power shifting and decolonization discourse, so much so that now there is a decolonize the decolonization movement discourse, right? So I think this is great because we need specific actions and accountability rather than just having these really lovely and inspiring conversations. Important, but it's time for more. So I really appreciate the research focus. I think who's identified as a source of data is really important. I think I come from a vantage point of thinking about research as one of the neglected components of that research and power shifting is really data production and data dissemination. So I think, who's the source of data? Who's considered an expert? Who are we leaving out? I think those are important questions to consider. And, a lot has been said and written about a lot of the activities as to how to take actions to further shift power when it comes to research and research collaborations. Two things stick out to me. One is, and I think Shea Abimbola had talked about this. This is having structured author reflexivity statements in papers. I think that's an important point. Second, there's the Dulala equity checklist for authors and co-authors. I think those are really great, actionable, very research-oriented ideas. So I won't dwell on those a lot here, but I do want to talk a little bit about the DHS context that I had alluded to. So I work on the management team for it. It's a USAID-funded, nationally representative household survey, and it's been implemented since the 1980s. And I'm sure many of you are familiar with these data, so I won't go into it. That's the benefit of having this conversation at PAA. And although most DHSs are implemented using donor funds as well as host country funds, the surveys are country-owned, right? So I want to talk a little bit about what does that country ownership and country-led and country-owned, what does that really mean in practice? So there's this generally an open call for submissions at the start of every 5-year cycle to revise the content of what goes in the DHS, right? So you have it's called a core questionnaire revision. And the idea is to include new questions to meet emerging data needs and delete questions that may no longer be relevant. In this last phase, we've moved from a birth history to a pregnancy history. We have questions on mental health. There's a lot of really good stuff that happens, right? And I think a lot of global north institutions anticipate this revision coming along, and they have LOE that's dedicated for staff to think about revisions, right? What would we like to see? What have we been testing in some smaller settings that we'd like to see in one of these standardized global data sets? Now, if we are saying that these are country-owned, meeting data needs in countries, we're not actually making a concerted effort to see who is actually submitting into this kind of open portal. I would wager a guess that most ministries of health, civil society organizations, advocates don't even know this is happening, right? And then they've missed the boat. So what we're really seeing is priorities of people like you, people like me. And no wonder the research is not actually benefiting, Bernard, your point about is the research being done in an effort to reach the populations it serves? It can't if the content doesn't reach there, right? So that's one point. And I'll acknowledge I'm holding the mirror up. This is something that I need to do better, and my team needs to do better. And it's something that we've been grappling with just in the last few years, and we're making a concerted effort for the next time around to be more transparent and open and reach channels that we're not reaching right now. So that's one. And then second I want to talk about is the DHS funding. So when we say power shifting in research, I would categorize power shifting also in that data production and data funding bucket. And I think this was alluded to before, is whose priorities get set based on who's funding it, right? 60% of the surveys in this last round of DHS, 60% of the funding came from external sources, not USAID. But most of those sources were UN and a lot of those other development partners out there. And a smaller proportion comes from host country governments. Now, There are some exceptions, of course. I think in the last India survey, almost all the survey costs were borne by the government. But they're the exception and not the rule. Now, there is this constant struggle between governments with strained budgets who still need these data to be collected, analyzed in order to make their own policies, allocate resources, etc. But when donors come in, it comes with some strings attached, right? So if UNICEF comes in, I'm just taking an educated guess and liberties with this audience. But if a UNICEF comes in, they want to see the child labor and discipline module being implemented. Is that what the country really needs? Is that policy-wise, is that something they're grappling with? Or is, it may not be, but it may be. But it's one of those things where you're putting funding towards a survey and having your own agenda versus really thinking about what the country needs, right? And so I think we need to then hold a mirror up to ourselves. What are we willing to do and willing to lose if we decide to diversify funding in a way that doesn't make countries so reliant on donors, right? Then we may lose standardization, we may lose a certain number of things, which may mean that the survey itself is very different from what it looks like now. But maybe that's okay. Or is it? I mean, you're all academics. I think you've all probably published a lot of papers and helped with wherever you are in life right now using some of these data. If we lose standardization, is that something that you all can contend with in light of the fact that countries are doing it their own way, and that's actually a good thing because they're doing it the way that they need to be doing it. On that topic, I'll add one more thing because Bernard, you reminded me, it's about the reaching of research to intended audience. There's a lot to be said about how we can make publications reach its intended audiences, but I think I really want to underscore that point because in the DHS we do a number of biomarker testing. We do anemia testing, HIV testing, malaria rapid diagnostics, and even when we ask questions on domestic violence, there is a referral back to the participant, and there's counseling if need be, and you can refer them to the health clinic, et cetera, depending on their results. There is an ethical and moral obligation we have in order to do that, right, on the spot. But why don't we feel like we have an ethical or moral obligation to have that same feedback loop when it comes to the results of our research? It just doesn't happen. And back to the funding issue, we're struggling to fund the core of a survey, right? This is the field work, this is the training, this is the equipment that's needed. And so in making these budgets, what do we tend to cut then? The dissemination pieces. So we may have our national dissemination, but we don't then provide the funds for that feedback to be where it needs to be, frankly. I've just rambled on a little bit, but I think these are really important points, and I think they're uncomfortable conversations and questions that I'm posing. I don't have answers to them, but I think these are exactly the kinds of questions that we all need to have rather than just sit back and think we're doing okay by just talking. Thanks.
Really, really great points. Thanks very much, Purva. Althea, we'd love to hear your thoughts.
Yes, Apurva, thank you so much for the DHS example. I think it's a great way of illustrating how we're trying to really, shine a light on what would it mean to kind of rethink our conventional practices in the field. And so much of what each of you has said really resonates with me. I'm going to really kind of answer this question about power shifting in terms of what does it mean for me as a funder? How have we kind of looked in that mirror and said, what do we need to really change in our own grant making practices? So one thing I'll share is a central conviction under Hewlett's Global Reproductive Equity Strategy is that national and regional SRHR ecosystems, specifically in Africa, because that's where we fund, will be better able to serve the needs of women and girls if decision-making resources and opportunities for collaboration are closer to those being served and impacted. I think we've all just said that. So as a funder, what is my role? It really is to contribute to ensuring that proximate organizations and actors, this is a language that we use, proximate actors, because in our work to strengthen ecosystems within a region, we understand that there are a lot of different civil society actors, and some of those are global actors working in a regional setting or a national setting, and some of those are indigenous civil society organizations working in that setting. And so what we have decided in our power shifting work is to really to ensure that proximate organizations and actors, this includes African research institutions, African think tanks, play central roles within these ecosystems. And we want them to be strong and sustainable so that they can maintain their relevance and their influence in this type of transformative policy change. We're talking about program change, even despite political shifts that we've been seeing recently, as well as economic downturns. So that funding looks like more direct funding to African headquartered institutions. It means really talking about how subcontracting onward grant making actually operates, what are the inequities in these resource allocation and business models. And this is something that we have, it's been, I would say, kind of our central kind of way of enacting power shifting within our sphere of influence as a funder. How can we really interrogate how resources are allocated? Because it actually matters in terms of who are in decision-making spaces, because they have the ability to be really responsive to what policymakers need, what other types of evidence users need in the field.
All right, thanks very much, Althea. So next I want to move on to another question. So I think we're all here because we care about decolonization and power shifting. And I think we're all thrilled to see that there's more momentum and discussion about this. But have we made progress? So my next question for the panelists is whether we've actually made progress in shifting the way things are done. So maybe we can go in reverse order. Althea, if you don't mind.
Sure. In terms of what equity looks like for us at Hewlett, it really is around equitable resource allocation, equitable partnership practices. And I'd love to provide like a really practical example of what a research partnership that centers equity. So I am getting ready to renew a grant to an American university and universities in Senegal and Burkina Faso that are focusing on misoprostol use in formal and informal health sectors. So when the three principal investigators of this project approached the foundation, they were really clear about wanting to disrupt kind of the conventional terms of global North, global South partnerships. So what this has meant in practice in a particular research project is splitting the funding equally between the three universities. And this includes indirect costs between the three universities, one in the US, two in the African region. It really is also about centering African universities and scholars in the production of local knowledge to improve health systems and policy. They all worked collectively in designing the research methodology and training graduate students in Senegal and Burkina Faso to conduct the ethnographic research, and being open to their ideas as young adults living in these contexts because they are closer to the reality of limited access to reproductive health service. It means ensuring that the data analysis software license was available to all three universities so that they could analyze the data collaboratively. We won't even get into like what that means for publications, but like all these steps actually matter. And the US university also extended courtesy appointments to the PIs in Senegal and Burkina Faso to help the team facilitate access to online academic books and journals. So I feel like as we're talking about like, what do we mean by power shifting? I really agree that there's been a lot of conversation, but what does this mean when we get down to resourcing the work that needs to be done? And here are just very clear examples that funders can be asking when they're partnering with research institutions and on research projects of what does this equity look like in action?
Great, thank you. Purva?
Yeah, I think advancing equity in research collaborations has to start with what we all started with was understanding and acknowledging our own positionalities. You know, what is power? What is my power? What does a power analysis look like? Who am I shifting power to? when it comes to research collaborations, there's so much that has been written in terms of authorship guidelines. I just mentioned before, what do editorial boards need to look like, et cetera. So I think I'll focus on some actionable kind of thoughts that come to me, and this was part of the tirade before. I think one is, as academics, let's consider, and again, this is Shea Abimbola's words, the gaze with which and to which we are writing to. And he has a really wonderful paper where he asks a question that I'm actually going to read. Can these solutions in power shifting result in moral licensing? That is, can the self-congratulation that'll very likely accompany having these measures in place make us excuse ourselves from addressing more fundamental issues? And I think that's really important. We're not looking for band-aid solutions, although there are so many to be had. What are some of those long-term solutions? And I think, to me, I will focus on some of the DHS examples that I gave, ensuring that local voices are actually incorporated into the questionnaire design is one, finding ways for countries to be true owners of their surveys without the donor dependency that comes with funding. And I think I would say that there are two things that the DHS program has done really well when it comes to the research aspect. And the number one is the DHS Faculty Fellows Program. It's a program that's been around for ages, and every year there's a couple of cohorts of faculty fellows that are selected based on countries with recent DHSs, and the DHS research team helps provide guidance and train them on going from a research question to analysis. Some of them haven't done analysis in Stata or R in a long time. How do you go from an idea to a full paper? And the idea is not just to publish, it is very much, yes, let's have a publishable manuscript. But how do you then take that information and go back to your home universities and apply that to the syllabi and the curriculum that you're teaching? And I think it's really been very, very successful, and I'd love to see more examples of that being done, where you're directly kind of doing that work with no intention of having that co-authorship. It's really just a training program that seems to be really, really successful. And I think training a cadre of academic activists who want to move research into action is really important, because I think we're all here because we care about research, but we don't care about research as an end-all. We care about research for what it means. But very, very few incentives exist, particularly for junior researchers and junior scientists, to actually take that research and partner with organizations that are going to take that research and bring it to action. We don't give tenure based on that. We give tenure based on publications and where you're publishing. And I think that's a perverse incentive if one wants to actually make some sort of a difference. It's way beyond my pay grade to say anything to deans or chairs of departments, but I think this is really important, especially, these conversations we're having because they're coming from younger scholars and younger researchers who are seeing these inequities and want to make a difference. But if we're not going to embolden them to take that next step and say, this is worth your time, and this is worth your time for your communities, and here's how we're going to support you, it's a little bit of a wasted effort. Thanks.
Chris?
I will probably expand a little bit on what Apurva just mentioned. It was one of my points to make about who actually is on the table when we are talking about this idea of decolonizing or shifting power. Because if we don't have the person who has the power, then technically we can't shift that power because we didn't talk to them. And I think that's, at least from my experience, it feels like sometimes we are preaching to the pastors or to the priest, because most people who are in the room get it in a way. But how many times have I seen maybe working in Hopkins, president or dean really engaging in that discussion? Probably once. And do they sit down and talk to the faculty and say, hey, this is what's going on in field and we have to really address it? That I don't know, because I was not to that level, but nobody ever asked me, we need your inputs because this is very important. So I think in a way that's kind of misguided effort if we can't get people who can actually make decisions on the table. And that also applies to the countries where we are working. If, for example, we have to look at who is on the table when we are talking about balancing that power and making change. And one of the issues that we rarely probably address is like the turnover when it comes to institutions. Maybe I would give an example in Rwanda. Turnover is pretty high, and there are reasons for that to be. So if those reasons are not addressed, it will only continue to happen. And with really the change, or maybe if you are trying to build the capacity, with that capacity be there, I think the answer is likely not. So that also expands to my second point with education. So most of development partners have invested in programs, services, but not necessarily in who actually gives that service or who implements those services. And you see it a lot. I currently run an NGO in Rwanda, and my wife is very supportive because I put in so much time than I actually put in my PhD, because there is that gap of knowledge that you know and you understand it because you've been in the same education system. And you know that if that part is not covered, you are probably not going to do what you hope to do. And there have been so many models of trying to address capacity. And I think the model that's growing really fast that I'm personally not a big fan of is having a US institution moving to Rwanda or to Uganda and competing with the public institution on the resources. I personally think that's really wrong to the core, because what will happen is you're recruiting very well-educated, very high-skilled professionals from international universities competing for grants that otherwise could have gone in the public system. And basically what that does is that the most poor, very talented person will never get access to good education. So, I'm mentioning that it's probably my personal frustration, but I also see that happening a lot. So I know you probably all get different networks, but I personally think if you are thinking of addressing the education, it has to be through the public system. And we cannot build research capacity or research future without the human resource who actually will do it in the future. So that's really something that we have to focus on. That's to you, Bernard.
Yeah. So I'll sort of pick up from where I left, because and remember when I was introducing myself, I said that I'll circle back to, my sort of education pathway where I did my graduate studies in the U.S. I think that, so just to address your question, I think that we're in a promising space at the moment in the discussions and the actions around the power shifting. But for me, I think it's really critical, if we are talking about research power shifting, that we address the limited resources that researchers and academia have in the global south. I think that's really critical, because as we speak, a lot of the people who are able to for example, write up competitive proposals in the global south, people who are implementing research programs there from the global south, very many of them have a background of training in the north. And they also have, part of it, they also have networks, critical networks that they're able to tap into to actually succeed. And so for me, looking at, and I know that later on we'll also be hearing from Jacques Amina, who's at the University of Kinshasa, and I'd like to hear more about, what's really actually happening, at the universities. I'll give you, I'll give you an example of some of the challenges. So when we talk about, say, data, researchers in Africa, even at the universities, some of them have greater challenges to access data from their own country than people in the north. I'll give an example of the census, right? So the census data, for example, a graduate student in the U.S. would be able to get access, and they know how to get access to IPAM's data, so they get that data, and they'll publish, and they're able to answer critical questions. Some of the people at the universities, teaching at the universities in Africa, one may not be aware of where they can get this data from a place like IPAMS, but why should it be at IPAMS? Why not at University of Kinshasa or University of Nairobi? But secondly, so if you're in Kenya, how do you get the census data? You have to go and apply for it from the Kenya National Bureau of Statistics. Access, just the bureaucratic access is, quite strenuous. But apart from that, it is very costly. And unfortunately, the universities haven't put in the resources to allow their own faculty, for example, to actually be able to do that. And you can imagine, if that is for faculty, what about the students? So the students are even in, the graduate students are in a much worse position in a sense. And that's why, for me, I think critically we have to work around making sure that our universities and research institutions in the Global South actually have the resources to be able to do this. And part of it, in terms of sustainability, in my view, at the end of the day, we need to, our countries need to also put their foot forward and put in more money for research. I know people say that we don't have the money, but we have money, for example, to do infrastructure projects. So what are the priorities? We are building roads, and we are able to take loans to do that. But when it comes to putting in money for research for critical things, we know that, and maybe that is another thing that we need to discuss. How do we balance this issue where we know that if we don't put money in research for health, for example, there's going to be a USAID will come in to fill in the gap. There's going to be an FCDO who will fill in the gap. But of course, when they come in, they come with their priorities, and their priorities change. When there's, as a researcher in Africa today, and getting funding from agencies like USAID and FCDO, at times I'm more vested in some of the political election outcomes in these countries than some of their own people, because the election outcome could just change priorities overnight, and overnight, whatever you're doing, it has to be shelved. So at the end of the day, sustainability will be also in making sure that we do more in increasing local financing for research in Africa and in the Global South in general. Thank you.
Great. Thanks very much, Bernard. So I think we have time for one final question. And this is something that all of you have already touched on, but I want to give you the chance to be very clear and explicit about your response. So what actions will you be taking to move the needle to shift power and advance equity and research collaboration? So what do you plan to do moving forward in the future? So Bernard, maybe we can start with you.
So I have to, for me, it's about, I'll say two things, which I've already mentioned and talked about. One is definitely making sure that we have, stronger collaborations with African Global South institutions, research institutions that are, equitable collaboration. So I saw, the kind of example that Althea made earlier in where, you have all equal resources, and it's not just equal resources for LOE, but also resources to make sure that the infrastructure to conduct the research is available. So the research assistant in DR Congo has got the same kind of research infrastructure available to them as a research assistant at an American university or a British university for that matter. So for me, that is critical. And so as AFIDEP, and as I earlier mentioned that, we work across Africa, and now increasingly also in other countries globally, but we are only located in Nairobi and Lilongwe. And how do we then make impact in other places? It is also through collaboration. So I think this collaboration is not just about North-South, but also South-South collaborations are critical, and we are able to then have greater impact. The second thing for me, I'm really passionate that there is that translation of the research to policy to action, and that is an area as AFIDEP, we are very keen to definitely engage stakeholders, whether it's policymakers, but as increasingly, as Jacques mentioned earlier, we need to also, it's not just the policymakers, but it's the local, the people in the communities. Are we actually responding to their priority needs? And I'll give a final example as I turn it over. So when we had, COVID-19 as a crisis, all of a sudden, there was so much money to do research, and everybody was linking everything they were doing to COVID-19. And it was the easiest way to, probably the fastest way to reach. I mean, there was a huge resource packet for addressing COVID-19. But you ask yourself, you go to a place in Homa Bay in Kenya, one of those rural places. It was really, they had more pressing needs. I mean, for example, their nutrition. There are places where nutrition, there's a crisis. There's drought, there's such crisis. And for them, they're saying, oh, why are we spending so much money on this COVID-19, which, yes, it's a global issue, but it's not our local priority. And like I'm speaking today, the country bought or stockpiled COVID-19 vaccines, which are now expiring. Lots of money that could have been, put into other local needs. So yeah, that's what I would say. Do more towards really bridging that gap to address the needs of the people that we hope that this research actually should be, beneficial to them. Thank you.
Yeah. Bernard, thanks very much. I think those are really interesting points. And it kind of crossed my mind that in surveys, one question we don't ask is what participants think are the priorities for them. And I'd love to hear their thoughts. If we ask them, and gave them a rank, or a list of options. What do you think we should invest in? What are the problems that are most important for you? I'd love to hear their thoughts instead of, we know what ours are. Anyway, Chris, over to you.
So I think building on what Bernard just mentioned, I think one lesson I learned from the demographic dividend work is that beyond what we are doing and meeting at conferences and talk and share some problems that we are all facing, I think there's a need of what we probably could call a public health diplomacy, some form of it, in a way that we want to make sure that those people are making decisions that Bernard just alluded to actually understand what are the implications in the health of people. If you were the one making decisions on certain finances that have to go to in a certain direction, because in many countries like ours, maybe it's only like 4 people making those decisions. So if we were able to educate those people, maybe there may be more local resources going to research, or maybe supporting more research translation. So I know there have been some form of that, but I think it's something that should be very intentional, and that should also be able to kind of mediate between those execs that we never get to meet and probably the government, because if the government says this project is not happening, it's not going to happen. So I think then even those people who not necessarily be willing to engage in a certain conversation, obviously they will have to. So there has to be another entity that does what we are not able to do now, basically.
Yeah, thank you. In terms of the actions, there are a couple that come to mind, and newsflash, it's actually not about the DHS, but about USAID as a whole. But I do want to make 2 points. I think what we all can do differently is, if you're analyzing DHS data, try to figure out and understand the context of what you're researching, right? Set up a Google News alert, whatever it is. Don't just say, I just want to do a cross-country comparison because all of these countries had data that was released this year. Okay. And also understand, look at a final report, look at the skip patterns, look at the sampling, look at all of the other things that goes into the data that you're analyzing, because it may be really illuminating. Second, I think that if we're being serious about localization, listening to local voices, I think it's important that we build those bridges that Bernard was alluding to in terms of the research policy to action. I look at Goodness as, an activist young scholar, and I think that we need to build more bridges with people like her, and I think dialogues like this are really important to get there. When I was doing my PhD, I was very clear, and a few of us in my cohort, that we actually wanted to look at jobs outside of academia. And there was no real support from faculty at that time. In fact, quite the opposite. So we kind of charted our own course blindly, right? And I come back to conferences like these, and I become a grad student all over again, because people will look at your badge, they'll place you in a hierarchy of who you should get to know, who's going to be better for my career. Instead of just, can we just have a conversation and learn from each other and see where collaborations go? So I have these pleas out to you all. But I do want to state, in terms of what we're going to do differently, I think at USAID there is a real conversation that's happening about localization. And I think the idea is to lead with humility. I think humility is a word that we all should think about and what it means in the work that we're doing. The localization idea is not new. It's kind of what you were saying, each administration has their own way of saying the same thing. It's really a set of internal reforms, actions, and behavior changes that we're undertaking to ensure that we're putting local actors in the lead. And there's also, you were talking about funding. I think the goal is by the end of fiscal year 2025 to provide at least a quarter of all of our program funds directly to local partners and kind of do away with a lot of the intermediaries, and to ensure by 2030 that 50% of our programming will place local communities in the lead to co-design a project, set priorities, drive implementation, and evaluate the impact of programs. The devil is in the details, but I think these are important metrics. Like we haven't really had really good metrics to hold ourselves accountable, and I'm really excited and optimistic about the agency's kind of approach towards doing some of that. So I'd like to see more of this direct grant making to local organizations. USAID's PEER program is an excellent example. It's wrapping up. It's the Partnerships for Enhanced Engagement in Research, where it does exactly that. And so I think some of those ideas are trickling and certainly in the works. And on an aside, as someone who has no power within the US government to do any of this, I think we need to acknowledge the difficulty with visa denials and the ability to travel for conferences like this, but also other academic conferences, and what we need to think about. I know that there's folks who've said we need to just have conferences in areas and countries where folks can get to. I think that's a really good idea, but what more can we do? It's gotten to the point where it's really truly embarrassing in terms of who can get to travel and who doesn't. Apart from the funding obstacles, it's just what passport do you hold? So yeah, I'll like to stop there. Thanks.
Thanks, Apoorva. And Althea, in case you didn't hear the question, it was what are your next steps and what do you plan to do next to promote equity in research?
So I just want to echo again what Apoorva said about accountability mechanisms and metrics about what does equity look like in practice, and making sure that those indicators and the progress we're making is transparent, 100%. I think for me, action is around more attention to kind of our interconnections. So, as a funder, I've heard some really troubling accounts from our partners in the Global South about the funders' trend to localization and decolonization. I've heard concerns that this trend could be short-lived, and that our partners are really concerned if they speak out now and claim more power in these relationships, it will be detrimental to them in the long run once funders move back to more conventional funding practices. Some have expressed that funders' localization efforts have created more competition between proximate actors instead of promoting collaboration. And for others, some feel that localization feels that they've intentionally received more resources, more decision-making power, but because the ground was not laid first for these kind of sudden shifts, there have been kind of, what is the term that I want to say, set up to fail. And so for me, I think, and again, I often, call upon the funding community, like what do we need to do to shift the needle in terms of power shifting? I think it's really making sure that we resource proximate actors for long-term sustainability and doing the work internally within the philanthropic community to ensure that decolonization is institutionalized in our grant-making practices, so we do not revert back and actually punish those who took the step forward for more transformative change.
All right, thank you, Althea. So I think that brings us to the end of this session. Much as I'd like to go on, I think unfortunately we're out of time. But let's take 1 second to give a round of applause to our panelists and thank them for
So we want to spend a little bit of time reflecting on kind of what some of the opportunities and challenges are for this type of change, given your own work and your own experience. And so what I would like everyone to do is on your table you should have markers, and you should have 2 different kinds of, or at least 2 different colors of sticky notes. So if you can get a few of one color and a few of another color, what we're going to do is we're going to spend a couple of minutes at your tables or either in clusters or by yourselves, kind of thinking about opportunities to power shifting and barriers to power shifting. So use one color for opportunities and one color for barriers. Let's start with some barriers. Let's see, there's quite a few over here. Languages. Which language is considered primary? And vocabulary, that's very context specific, and a big problem with publishing. That's a good point there. They're falling off the wall. Access to technical trainings. Somebody's got some great handwriting over here. I need to pay my bills. Okay, we got a very practical concept. Senior research is overtaxed, if I can read that correctly. Researchers are overtaxed. There we go. There's no funding for local dissemination. I know Apurva mentioned that in our panel before. How to understand the preferred process and whose preference is followed. I think that's a good consideration as well. Let's see. We got some long ones here. Okay, in some settings, very few organizations that do rigorous research to standards that will be funded by donors, which results in a monopoly at the local level and an inequitable distribution of resources in ground research budgets. Ooh, there's a lot to unpack there. But I like that.
Okay, you're right, sir.
All right, lack of experience with the system. We've got adequate capacity for effective researchers and core flexible funding. I know core flexible funding is a big deal that came up during our panel as well. No shaming of northern researchers who exploit low and middle income countries' data to advance their academic careers. All right. We got a lot in this room. I like these thoughts. Those who hold the power may find it hard or be unwilling to let it go. I think that one we've seen before. Funders not requiring partnerships to be established before proposals. That's a good one too. We got a lot of barriers here. So we're going to shift gears. We're going to go to opportunities, and I'm going to put Jeff on the spot for this one.
Opportunities, learning from different contexts and past successful collaborations. I think there are some great examples. Funders do want to find ways to do this. I think we see more funders lining up that way. Opportunities, start dialogue about values with country partners, gender, social strata, etc., country sociologists, and local accountability structures. Let's rescue this opportunity, communication. Okay, younger generation of students are more aware, engaged with the issue. Great point, again, as some of us are moving towards the latter parts of our career, let's fill this in with people who actually are fundamentally involved with it, and it's not something new for them. Let's see, bringing key decision makers to the table, deans, donors, etc. First, authorship on publications, including high-impact journals. And let's see, do one more. Growing appreciation of Northern bias in survey instruments and analytical frameworks. So again, the more conscious we are of it, the better our chances are to actually start addressing this.
Good afternoon again. Welcome back from coffee break, everybody. I hope everybody got time to do everything they needed to do and to chat about some of the conversation we had earlier. I'm Julia Hernandez. I'm a professor with the Tulane School of Public Health and Tropical Medicine. As mentioned earlier, in terms of positionality, I'm extremely confused because I'm Spanish, French, Jewish, and Algerian. And I've been working in Sub-Saharan Africa for about 15 years. And so a lot of the conversations that were going on are of high interest because I have lots of questions and very few answers. And so to help a little bit maybe with some of the answers, I would like to introduce Dr. Jacques Emina from the University of Kinshasa, who also is a professor and also is the director of the School of Population and Development Studies that was very recently created at UNIKIN. And whom I will invite to introduce himself as well in terms of positionality and if he had to introduce his institution. And then we will turn to Dr. Thomas Leviste, who is the Dean of the School of Public Health, so my boss, and who also I would like you to introduce both yourself and Tulane School of Public Health. Let's pretend no one in the room has ever heard of us, and how would you describe us to a global and diverse audience? Thank you. And Professor Emina?
Yeah, I'm Jacques Emina, demographer by training, director of School of Population and Development Studies in Kinshasa, University of Kinshasa. So my research interest is mostly sexual and reproductive health and data production and data analysis, and also monitoring and evaluation of programs. So, yeah. I'm also, at the same time, I'm leading a research institution in Kinshasa, Population Health Research Institute, and I'm also the Secretary General of the Union for African Population Studies. Thank you.
And I'm Thomas DeVries, and I am Dean of the School of Public Health and Tropical Medicine at Tulane University, and I'm also a demographer, although at this point I've strayed so far away from my roots as a demographer, I'm not sure I'm still a demographer. I don't know what I would do with a life table if you gave it to me at this point. And I'm the Dean of the School of Public Health and Tropical Medicine at Tulane, and assuming no one's ever heard of the school before, the School of Public Health and Tropical Medicine at Tulane is the first school of public health established in the United States. I know this is co-sponsored by Hopkins. I spent 25 years on the faculty at Johns Hopkins, where I thought Hopkins was the first school, but Hopkins was founded in 1916, and Harvard 1913, and Tulane 1912. So actually, we're the first school of public health in the country. Not the most important thing, but it's a thing. And we are really a global school. We have a very large international footprint, especially in the southern hemisphere. We've got projects all over the world. Well, obviously DRC, Rwanda, Ethiopia, Nigeria. I shouldn't have started naming countries. I'm going to forget somebody. South Africa, Peru, Taiwan, Dominican Republic, Cuba, Brazil, Colombia, and probably Costa Rica. I'm going to be going there this fall, and we'll be starting something there. We have a campus there, but the public health school is not currently in Costa Rica. And we endeavor to educate the world, and we also endeavor to learn from the world. And I think that is, part of the what we're talking about here today. That it's not just a one-way conversation where we are going into other countries and with our superior intellect and telling them how to do things, but rather we're also looking to learn from what people are doing in other parts of the world and what lessons can be brought back here to the United States. And as part of these partnerships that we're building out, we are building out exchange relationships where we do faculty and student exchange, where our students will have an opportunity to spend some time in other countries, learn about other countries, learn from the experts in those countries. And also, we are interested in having students and faculty from other universities and other countries come spend time with us to learn from us as well, and also to teach us what they know. So that's the school that I lead.
Thank you both for your introduction. From very different contexts, but you both represent a very important and very powerful institution. And how do you approach partnerships with institutions, schools, partners that may not yield as much power as you do?
Thank you. Yeah, we think that approaching partnership should be built based on mutual respect and also mutual learning, because we need to learn from each other, as well as taking into account strength and weakness of each institution. We do think that partnership should be based on benefit, on the opportunity that every partner should take from that partnership. Sharing expertise and knowledge is part of that process of partnership, because we don't take partnership as a cross-sectional thing, like a picture at time T, but it's like a process, continuing process, sharing responsibility through the collaboration is what we think.
Yeah, I think I would agree with all of that, everything that was said. Partnerships, for them to be successful, have to be mutually beneficial partnerships. It's got to be something where both sides are getting something out of it, which is why partnerships have to always be tailored. You have to sort of come to understand what the other organization, what their needs are, what their interests are, and figure out how do we help them to solve a problem, and while they help us to solve a problem. And that's was what's going to make it sustainable. I know in public health, there's a lot of talk about community-based participatory research, and people talk about researchers going into communities and humbling themselves and deferring to the community. And I've always bristled at that. I said that, no, it's you go to the community as equals. You don't go to the community and say, I'm going to subsume my expertise to the community. The community has expertise also. You have community, you have expertise too. And we're all experts bringing our expertise to the table as equals. And so sometimes I do think that academics, we overcorrect from past wrongs. And I'm sure we'll get into some of those past wrongs. There's been a lot of them. But I think that where we are now is that we shouldn't overcorrect either. We need to have relationships that are true partnerships of equals, where everyone is getting some benefit out of it and everyone is getting their needs met, and we're treating each other as peers.
And so could you give us some examples, like very concrete steps in which partnership could be more equal between your institution and other institutions that are either more or perceived at least as more or less powerful than where you are?
As for me?
Yeah.
You're looking at me, okay.
I'm like, I'm ping-ponging.
I think, I'm surprised the word trust hasn't been stated yet. I mean, trust is such a critical part of this, and the way you build trust comes with consistent behavior over time. That is the only way you can build trust. So if people, I would tell some of my colleagues when I was in Baltimore, I'd say, look, they wanted to go into communities. I would say, look, go to the community, go ahead and have that town hall meeting, and you're going to get beaten up. I mean, verbally, not physically. But you're going to get beaten up. But come back next week for the next town hall. And when you come back, that's when they're going to say, okay, this is somebody that we need to pay. We need to at least hear this person out, because this person is consistent, they're persistent, they really are trying to build something with us. And that's what I've found is what works. If people see you as being consistent, people understand what you're about, you're transparent about what you're trying to accomplish and why you're trying to build a partnership. I tend to think that people will trust that if they understand where you're coming from. So that's the most critical thing. Being consistent, being persistent, being transparent, and building trust.
And so, Professor Amina, do you have a reaction to this? And from your own experience, because I know you've dealt with a lot of American and European universities, have you seen that type of behaviors? Have you seen other behaviors that maybe have been less conducive to trust?
Okay, my answer will be mixed. Mixed because sometimes you have some Western institution came with rules. Those rules are based on their power. They say, okay, we are bringing the money, you have to do this. And mostly in that case, African institutions are considered as data collectors. They collect the data, and the data are stored somewhere else, and then you don't have access. If you want to publish, so they can consider you as a first author, but actually, they just put your name. You are not really involved in the process. But at the same time, there are other institutions that are more respectful. So you are using a participative approach where you are involved from the design of the research to the scientific writing. So you are involved in the whole process, and you have to share responsibility. So that is a mix depending on both North institution and also on the South institution, depending also on the PI from every side. So that is the complexity of this discussion.
And picking up on something you said, to build trust, you have to show up at the town meeting week after week. We know that the structure of sponsored projects, of research grants, it tends to be short term. There's not necessarily a lot of funding to spend time together with the people you supposedly working with. Is that something that, I mean, you see as a structural problem? Is it something where you see a way to address this? Even that process of twinning that is very popular right now is very resource intensive. Not everybody has the luxury of spending 15 years studying the same issue in just one country and build those trust. And so what is your impression about this? And then I'll ask the same question from you, Dean Levist.
About the trust of institution, I think as I say, it depends on the partner. So I will avoid to generalize because there are some institution and some PI from the north that consider really respect and that they are transparent, the process is transparent. And this allow to build long-term collaboration. But there are other, the process is really very low and take time to get to the trust, mutual trust. Because I think the trust is depends of what also the different partners bring on the table to negotiate. Yeah.
Yeah, can you ask the question again?
So the question, that idea of trust and solid partnership are built by being able to meet over time and showing up consistently, as you said, and the structure of international funding does not necessarily allow for that. It's more on the drive-by model, and that's problematic. So.
Yeah, well, domestic funding too. It's the same problem that we operate on these grant cycles, and then the grant goes away, the project goes away. That's a real problem. So, two responses to that. One, I want to say a little bit about what we're doing at the school on this issue in terms of our educational programming. We're working on sustainability. I've been meeting with the dean and some of the faculty over in the business school to talk about how you build out business models around public health programming that would create sustainable, sources of revenue that could keep these programs going. And it's an interesting idea. We're still early in those discussions, but the idea is to bring some of that thinking into the field of public health. This is a huge problem we have. There are a lot of things that we know how to do. There are a lot of problems that we can fix if there was enough funding, sustainable funding, to be able to stick to addressing the problem for a long enough period of time. And it's extremely rare that there's ever enough time to really make a difference. So that would be one thing I would say. We're trying to move towards that in the field. But in the interim, so one project that I'm really proud of that we did, this was in the U.S. It was this is Hopkins, so Baltimore. It was in Baltimore, in Southwest Baltimore, in a low-income community. We went in there and we collected data on people. And so the traditional model is that you parachute into the community, you collect the data, and then you say thank you, then you leave, right? And you may not even say thank you, right? And you leave, and that's it. But what we did was when we went into the community, we did what we call block listing, which was to identify every dwelling in the community by address, right? So we had that data. At the end of the study, we wrote a little report that was to the public, and we mailed a copy of that report to every address in the community to say, here's the data, this is what we found, so that at least you know you got the results, in addition to having a series of town hall meetings in the community and health fairs and town hall meetings where we presented the data to them. But even that's not enough. But I think, to me, that's the minimum that we should be doing. We also helped the communities to establish a new nonprofit organization that was working on health issues in the community, helped them to get it started, and then served on the board of that organization for a few years to help them get up and going. So I guess what I'm saying is that we need to, as universities, when we go into these communities, we need to be thinking about what can we leave behind that the community is going to benefit from, so that the community can say, okay, we did that, we cooperated with them, and we got this for it. We got this report, which gives us all this detailed information about the health of our community, which now gives us an opportunity to go to funders to get more funding for other projects that they're interested in. And, and helping to establish an organization, so an infrastructure that can be used to do that kind of work. That's what I think universities can do, and universities can make a huge difference in communities if we organize our resources in such a way that we try to make that difference.
Thank you. Femina, do you see some challenges to do this in resource constrained context where that type of opportunity is not necessarily existing, or there might be more barriers to disseminating the results back to the community?
Yes and no. Yes, because there are some challenges to go back to the field, and also for administrative process sometimes, for some cultural barrier for some time, and also for limitation of resources. So going back, we may need to have more resources to spend when your budget maybe is not allowing you to do that. Okay, so that is why I say yes, there are some barriers. No, because we can we are promoting now perspective approach, where we start involving different stakeholders from the design of a research, a study, until the publication of a result. So that allows to have communication through the research process, and that could be going beyond the research actually. So the unique barrier is after the project, you may not have enough resources to go back there. So some funders that are here, they don't allow you to have money to go back there, and our university itself may not have a budget to conduct research. Most of the research we are conducting rely on the funding from partners. The government doesn't allow us to give us any resources to conduct research. So having a leverage will be good, but that is the major challenge.
I think that we need to go back to those funders and tell the funders that there needs to be a budget for dissemination too. And that dissemination needs to be more than just publication in an academic journal. I'm not saying we should do that also, but that should not be the totality of dissemination, and we should get a budget for that. In that case of that study I talked about, we had a budget specifically for that purpose, because in the application we told the funder this is what we wanted to do. So some funders will support that if it's requested, but most projects we don't do that. We don't ask for funds for dissemination.
Yeah. Can I add something? Yes, we are currently planning a study on child marriage and sexual violence against adolescents in 4 provinces in DRC. So in that research that is funded by IDRC with a collaboration of UNICEF, we succeed to have UNICEF found some activity on the ground. So when we are going to collect the data, for example, if we found a girl that has been sexual violence survivor, so the UNICEF can take responsibility to refer the person to the appropriate place to take care of the girl, and also to link some adolescents with the justice or some other services to go back to school also. So that is doable, but we need to advocate funders and also to the government. They should take responsibility. They cannot every time give responsibility to partners. So we need to work together with funders and other partners to say to the government or government to take responsibility of that public activity.
You meant, so the point of having founding and dissemination, I believe, came up came up in the previous
conversation we had as well, and there are different levels of dissemination. There's no dissemination at all. We collect data in the community, but we disseminate to some officer at the Ministry of Health, which is not really disseminating back to the community. The example you give, I found was interesting because not only do you disseminate it back to the people you collected data from, but you also give them the power to do something about it, which is a step that's even more often missing. I was also listening to you both. You mentioned, well, we should talk to the donors, we should talk to the governments. It's funny because in the previous meeting it was like, well, we should talk to the dean. And there's that advocate, because in terms of, if we're talking about shifting power, all of us have a boss, and and what kind of power do we really have to shift if we're under some institutional pressures, demands, like I joke that you are my boss, you have a boss at the university, we have the demands from the donors, the government also has its own priority, and we often present shifting power in terms of how we can change our behaviors and how we do things. What is our responsibilities, what are our options to also change power up, not just down?
Me? Well, this is being recorded, right? So I'm not sure I want to say this on camera. But, I think, I spent most of my career, speaking truth to power and hoping that people will do what I want them to do. And sometimes they did, sometimes they didn't. And it occurred to me that maybe there's another way to do this. Maybe I should seek to be the person that people speak truth to and be the one in power. And let's see how that works out. And I think that people who have a sensibility for community work, people who have the respect for people and for communities and who want to work in communities need to seek to become the person in power. And so I guess I'm recruiting all of you as future deans, or whatever. But that's what I think is the solution to this. We need people in power who are the people who are going to do the things that we want done. And if we continue to elect people who offer thoughts and prayers after a mass shooting happens, and then they get reelected, at some point, they're not the problem. At some point, we're the problem because we're continuing to put them back in office, right? So if we get people in positions of power who actually care about the things that we care about, that best happens by us seeking to be the person in power and able to control resources and make decisions about how things get done. So our school will always work, at least as long as I'm the dean, we will work with partners regardless of where on the planet they are, and we'll work with them in a mutually respectful way because that's the organizational culture that we have, and I'm determined that that culture is going to be there as long as I'm in that role. And that's where I think we need to do. We need to get more people who care to be in a position where they get to decide how resources are allocated.
Professor Mina?
Yes, I agree. We need to continue to advocate, though sometimes with donor is not easy. We tell you, I have this amount. This is the way you have to use that money. If you do differently, you have to pay back. And so in the limited resources, you don't have choice. You have to do what they want. Okay? There are some of them that can understand, can listen, others they don't care. They say, okay, I have the money, it's for this activity, and then I don't have for your dissemination. Or dissemination for me is just conference, publish in the peer review, not go back to the community. So that it depends. So this is the major challenge. I think we have donor here, we have future donor here, I hope that we can understand the importance of going back to the community and to change the way we are thinking. Listen also, partner from weak partners, because you think that they don't have money, they are weak. Though I don't consider them as a weak, because we have other resources. They have human resources, they have mind resources, so we have to respect them. So yeah, that's what I can say.
Can I add one thing? You know, the dissemination doesn't have to cost a lot of money. It could just be go on the local radio show in the community and talk about the study and tell people what happened. Go to the church and do a presentation. I mean, I've done tons of presentations in church, you know, community halls. It doesn't have to be expensive. Now, ideally, if you have a budget, which we did, because we specifically requested one, that will allow us to make those little booklets and mail them out, that's ideal. But if not, you can find inexpensive ways also. But I think it should just be a value. If you're doing this work, you have to report back to people what you found, what their data, you know, showed, and how they can use the data. I mean, we actually, in that case, we actually even made a data set available to the community organization we created. And they have it to this day, and they've used it to get funding for other priorities in the community without us. And that's exactly what was the point of doing that.
Yeah. Okay, thank you. Yeah, I agree with you, Dean, but it's not, that is also a problem of a context. Let me give you example. Professor Jane here may say different things if I'm wrong. Okay, I'm saying that Professor Jane knows better DRC than myself sometime. Yeah, you are conducting a research in Tanganyika, and then you are in Kinshasa. So you have to go back to the field to report, to work with the community. I think not with $15 that you can go there. You need a flight. And you need also those people from Kinshasa to have some time there to pay hotel and others. So this is why we say sometimes it needs some resources, giving the context, okay, differently from the context. So we need really to involve community from the design of research to the end of the publication of the funding, to have both scientific writing and also some information that may allow everybody to understand what is going on the ground, so that we can expect change in behavior, we can expect population change in their well-being. So otherwise, we are just spending money and time for nothing, because nothing will change.
And if I may follow up on that, and I'm going to use the example of Congo, but there's going towards the question of what's a good partner, what's a good academic partner or a good research partner. There's quite often that confusion. If I had $5 for every time somebody thought Tulane was the donor, that the international organization through which funds are channeled is actually the donor agency. It is the one calling the shots, and that's creating imbalances. How can that be addressed? Because that's a giant misunderstanding, and what are some of the ways to solve that issue?
Okay, thank you. I have one example from IDRC, Canadian. We did research with ICRW, based in Washington, D.C., funded by IDRC. It was 3 African institutions, one in Rwanda, another in DRC, and another research institution in Nigeria. So IDRC decided to sign contract or agreement with each of the institutions. So the money was sent directly to the institution. So when we planned, and then each institution was involved from the start of the design of the project. We are all involved, and they asked us to develop a budget though ICRW was the main institution, just coordinating, each institution was almost has some autonomy. So that way, it allows different institutions to perform well and to build their capacity, even in terms of management of grants. So this a model we just experienced with ICRW and and IDRC in Canada.
Thank you. Dean Levis-Tinasima, I believe you have some experience signing MOUs. You've developed quite a few, I think, recently. And in that same vein, what are you searching for in an international partner? What's a good academic date that could be a future good partnership?
Good question. That's a good question. You know, I have read a lot of MOUs, and especially in the last month or so, it seems like there's a flood coming through, and they're all quite different. And I think that's right, because they should be tailored to the specific needs of that partnership. So what I say is what's a good partnership? It's a partnership where you can see where both organizations are benefiting from the partnership. That's the most important thing. Both organizations will benefit, and both organizations are getting something that they desire, and that there was some negotiation and some discussion about what do you in Kinshasa need? What do you guys want? What do we need? And so we can set the partnership in such a way that both sides are getting those needs met. That's the most critical thing. So like we do these, this is when, in fact, we're going in May, right, to DRC, and we're going to be talking about expanding partnerships with the School of Public Health there, and doing more student exchange. And one of the problems we have is the differences in tuition, the cost of tuition at the two different institutions, dramatic differences. So how do you get around that problem if you want students from the DRC to come to the U.S. and vice versa? Well, the way we set the partnership up with Taiwan, which was the first of these formal partnerships we did, is we said, okay, the Taiwanese students will pay the National Taiwan University tuition, the Tulane students will pay the Tulane tuition. So we're not going to ask students from Taiwan to pay our tuition, as we wouldn't ask students from the DRC to pay our tuition. And we just say, okay, there's an imbalance in how much the student is paid. We ignore the imbalance and we focus on the important part, which is, you know, the getting the student here, make sure the student gets what they're supposed to get out of their time in the country. So I'm looking for things like that. I want to make sure that even the way that they talk about the partnership, if I detect something in just the narrative and how they discuss it that indicates to me that there's some inequity there, I would challenge that whoever is the one putting the partnership together to say, have you thought about this, and why are you doing it in this way? And don't they have expertise there as well? So why are we providing all the expertise? Honestly, I haven't encountered that yet. It hasn't happened yet with any of the MOUs that's come across my desk, but that's the kind of thing I'm looking for, to make sure that it, at least on paper, looks to me like something that is equal or equitable, not so much equal.
And so, following up on that, there was a lot of conversation earlier about building capacity, the need to have research and researchers that are built there. We're talking mostly graduate programs here, and particularly doctoral programs, and there are several models floating out there from, you know, students doing the entire, I believe you're a proud graduate of Louvain, so doing their entire career graduate studies abroad, to sandwich programs with a lot of new actors coming in to the scene recently, to more punctual exchange program. What do you see as a preferable way of doing it from an equity perspective and a sustainability perspective as well? Like, how do we train the next generation of researchers, both here in the US, in the rest of the world, to make sure that whatever is being built here is sustainable and that we get towards more equitable partnership?
Okay, this is a complex question because of some contextual situation in some of the countries. But I would say preferably is the sandwich model, where students can learn from our institution, can also get advantage of other institutions, so they can learn from both sides. And also, even your student sometime can come to learn from our side, so that when they graduated, you send them for research, they can understand also the context. So that is the best model. But sometimes that model will fail if the local institution is not sustainable. But overall, I would say the best way is to have some training in the country, in local, and coming here or going abroad for more experience learning from outside. So that is the model I prefer.
And in your own, so we're gonna stay on that idea of training the next generation. How do you ensure that this movement toward power shifting, that your students and graduate and undergraduate students are aware of the dynamic that is going on, and that they are mindful of it in their future career?
So, just before this session started, Jane Bertrand, who I'm sure everyone here knows in the back, was commenting about me just being elected to be the board chair of the Association of Schools of Public Health, which was an insane thing to do, given that I'm just too busy to take that on. But the reason I did it was to answer your question. The reason I did it is because next year the accrediting body for the Schools of Public Health in the United States they're reevaluating their standards for accreditation, and I wanted to be at the table when the conversation was happening, because I wanted to ensure that the new criteria, the new accreditation standards, incorporated things like health equity, incorporated things like how you operate when you go into communities, cultural competency, things like that. And that's how you do it. At least for me, it's embedding it into the curriculum. I mean, as you know, you're on the committee that's working on this at our school. We're looking at all of these issues and trying to figure out how do we embed this into the curriculum so that anyone who comes to our school gets this training as a required part of their training as being a graduate of our school. So every school has the health equity course. Every school's got the cultural competence. Every school has it. But how many schools has it in their required core curriculum? That's our goal, to put it into the core curriculum so that you will not be able to get a degree from our school unless you've been able to satisfy those competencies. That's what we need to be thinking about. What are the competencies that are going to be needed as the 21st century continues to roll out? And it's impossible to know everything. But one competency we do know is that people are going to have to be able to be continuous learners. So we need to think about, well, how do we train students now so that they see themselves as lifelong learners and people who want to continue to evolve as societies evolve. So that is how I think you train the next generation. You start thinking about what do they need to have, how do we ensure that it's in the curriculum, and it's in the curriculum in a way that they will get it, they will understand it, and that it's taken seriously. And I think it only happens, frankly, I think it happens, there are some things that that have to be top down. And you have to be quite clear that this is not a democracy. You're going to learn this. If you wanted to get a degree from this school, this is what's going to be required of you, because the people we produce need to be people who can go into any community anywhere on this planet and conduct themselves in a way that is respectful and can have a good chance to build a partnership that can be impactful.
Thank you. Yeah. In addition to what the Dean just said here, I will add dialogue with a community, dialogue with policymaker as a key component of the training to equip young scientists and also graduate students on how to dialogue, how to initiate communication with, to engage with policymaker and also with a community. That is one. And second is to emphasize on policy research. Most of the time, we emphasize mostly on scientific research, empirical one, but I think we need to increase the policy research so that they can be able to translate the scientific knowledge into what the common people could understand and also policymakers will understand.
Thank you very much. I would like to ask one last question, and then I'll open it for the rest of the room. And this one was not in the script, so you'll have to forgive me. But I think you touched upon that. One dilemma. So for one dilemma I grapple with is: do we teach, particularly students who are underprivileged, come from minority, our international partners, etc. Do we teach them to fight the system or fight within the system? And what I mean by that is that I don't know what is the most, what would be benefit. I absolutely have no answer on that, but I feel like that's a dilemma we encounter. Where like, is it important to train people to know how to write a really nice USAID grant proposal, even though we know it's going to perpetuate some inequalities, or have a career in academia and move forward with that? Or do we want to arm them to change things, even though they might be, for lack of a better term, the lamb of sacrifice, because things are not going to change that fast? And I really would like to have both your thoughts on that. Do we teach people, or do we share tricks on how to play the game, even though we know the game is rigged, or do we try to actually change the rules of the game?
Okay, and you said I'm your boss, right? You do want to see a promotion? No. In all seriousness, I think it's both. We need good people everywhere doing everything, and some of those people need to be inside the system trying to make the system better, and others need to be outside the system providing the critique to help them to do better. When I first moved to Maryland, one of the first people I met was a man named Pete Rawlings. He's deceased now, but he was a senator, a state senator. He was the chair of the Ways and Means Committee for the state of Maryland, which is an extremely powerful position. He's one of the first people I met. And what he said to me, he said, I want you to come down to the Capitol, and I want you to testify before my committee, and you're going to criticize me. You're going to call me all sorts of bad names for not doing the thing that he wants to do, but can't get his other colleagues to do. So I come in and talk about why he's such a jerk, and he absorbs that, and then he goes back to say, see, the community is now. You need people outside the community, outside the system who can help, but you need people in the system. But the people inside the system, and this is the thing. The people in the system need to understand that they're in a system and that their job is to work the system. So often people get into these positions and then they don't use it. They don't use their power to try to make things better. And that is the problem. So we need to be training our students that we want you to be leaders. We want you to be thinking about leadership. We want you to be thinking about how you put yourself in a position where you're allocating resources. But when you are in that position, you need to use that position to make your community better. And that involves having partners that are outside the community, and sometimes you want those partners to come in and criticize you in front of everybody, because that gives you the cover to do the things that you really want to do.
Tamina?
Thank you. Yeah, I will answer to this question through 3 examples. We have the first case is a yes man or a yes woman. So he has been trained just to do what is required and to get the money. And you get the money, and it's like a robot will not change anything. And then you have a second case, you know that you don't have resources, but you want things to change. But you say, no, I don't want to do this because the community will not benefit. So the one with the money will not give the money. The another one will have the money, but he will do what the donor will say, and then the community will not benefit. In the two cases, the community will not get anything. And then you have a third case, is the middle, right training to tell them to raise resources, to get resources, but at the same time, you show them the right thing. What we need, we should do research for the community, because we can't do research for research. We are doing the research to improve population well-being, in our case here. So we need to train people how to apply for this grant or to free. At the same time, also showing them the interest and importance of changing things. In that way, they can get the money, and then when they are in the system, they can start advocating to change things. Otherwise, and negotiating even. If we have opportunity to negotiate, they can do that. Otherwise, we'll just waste our time doing research, and the population is still living in the poverty.
Right, thank you both. Do we have a little bit of time for questions from the room, Amanda? 5 minutes.
Thank you, Julian. Thank you, doctors. I really appreciated the discussion of values of whether that's collaboration or partnership or trust. This recent discussion about training and training your students and training those who are coming beyond. There's one other group that as institutions you are responsible for and that you have great power over, and that is your faculty. And so I'm wondering, can you speak a little bit to, in both bringing on faculty and particularly in offering tenure, are these values reflected in and part of the incentive structure towards tenure? So, you know, what's the difference between being the publication, you know, doing your own publication, or the difference of offering first authorship to someone else and collaboration? Are there differences in points that you get for those, or other kinds of things? So are there ways that this can be or should be represented in that constituency as well? Because you have great influence and impact over those who become your faculty.
Well, that's a great question, and that's a challenge that a lot of academic leaders that I know are all trying to work on this very problem. You know, trying to create the incentives and structure them in such a way that the incentives are to produce the outcomes we want. And I'm going to say we haven't figured that out yet, but we recently got funding from a foundation to work with several schools of public health on that exact question. And one of the things that we're doing at our school as an experiment is we haven't implemented any change yet, but we're now requiring everyone who's going up for tenure and promotion to write a statement about, you know, their work. And we don't know what we're going to do with that yet. We're going to read it and get a sense of what people are saying, and then try to figure out, okay, how can we incorporate this into the promotion process? So there are a number of, you know, institutions around the country I know that are trying to figure this out, but I'm not aware of anyone who's figured out how to do it just yet, because the incentives are still, you know, publish as much as possible, get as much grant money as you can, and as long as the students are not, you know, rioting outside your classes, you'll get promoted. But we definitely, I would say there are a number of leaders now in higher education that's thinking about these issues, and we're trying to figure it out. Well, that's part of getting that hat, right? So I can try to get some of that into the structure.
sorry, if there is no question, perhaps. Yeah, I just wanted, when you were both talking, you were talking about mostly citizen, the way I understand it, citizen research. So that is the participation, the research that you should do that should benefit the citizen. So, and what I'm just wondering is that, for example, because this meeting has been organized by funders, and we know that the research is taking place in the context of political context. So, matter what you do between powerful institution and no, let me, the term powerful and maybe high and low, I don't know which term is that, the one from the high income country and the one from the low income country are context specific and political context. So, but what I don't understand is the link between the funders. What are we at the funders doing to prepare for this environment, the two environment there to work? At the funders, what are you doing with government, for example, the one that are here? Basically, the one that are here perhaps are supporting you funders to go out there. But what about those government there in those low-income countries? Is there any dialogue for the two founders, government here, founders, government there, in such a way that the environment we are working together should work? Because for me, I think that will be the ultimate. If the political environment is ripe, I think everything we are going to do here, for example, going to the communities, in low-income countries mostly, these communities are neglected because also the basic facility for the government is not there. And are we going to continue just like this, or also involve this? I'm sounding like an activist, but that is not my aim. My aim is that, are we going to continue doing this in this environment, or can we engage this political, the government, especially in the low-income country, because the amount of budget put in the research is zero. Are we going just to continue like this, or can we do something here with the government to pressure, not pressure, but work together? How are we going to solve this problem? Sorry, but it was long. I don't know whether it is clear. Thank you.
Yeah, thank you, Kandala. Yeah, I think, first of all, I say that at some point that we need not only to talk with donors, we need to engage policymakers in developing countries or in our countries. I say that. And the second, I emphasize for training that we need to train people for policy engagement, dialogue with policymaker, and also dialogue with community, is to raise awareness of both community and also of policymakers. And the last one, my answer is, I did not answer the question Jeff just asked here, because I know that in our country, mostly public university, you don't have your real policy for promotion or things. So it depends on the political level. So this is why I kept quiet when the dean was talking, because I know that even if I'm the director of School of Population and Development Studies, even the Vice Chancellor of the University of Kinshasa will not change anything regarding the promotion. It depends on what the minister will say. This is the rule for getting promotion. You have to obey to this, and then you don't do anything. So, but the best way for us is, I agree with you, the institution in the North can negotiate, advocate to the donors when they came for partnership with the government, put some of those points on the table to discuss. But we need also from our side start negotiating, advocating to raise the awareness in terms of research, to put them in evidence. So it's not normal that all research, for example, in DRC, are funded by partners. There are no single dollars coming from the government. There are no money. All research are funded by partners outside the country. So you don't have a research plan, national research plan. You don't have, because you don't have the money, you don't have a budget. So that is the point. We need to advocate, and then we need also support from donors and partners from the North.
Thank you both very much. You gave a great example, and I think I'm going to ask you your final thoughts on that point. On the shifting power has been expressed as taking a step back, perhaps, but how do we not disengage? Because you gave an example of, well, if you disengage, then there are inequalities that are going to pop back up. And how do we make sure that while taking a step back and shifting power, we are also not necessarily allowing for inequalities to replay and local power plays to replay? Or is that not our role? Is that too paternalistic to be thinking like this? What is our position in the future as we're trying to make sure that we have more equal partnership vis-a-vis that potential risk? So who wants the last word? So the question is, can we shift, in order to truly shift power, in your opinion, should northern organization step back, or should they find better way to stay engaged? And what will be, according to you, what will be the challenges?
Okay, thank you. I think shifting the power and also promoting equity, I think it needs some capacity building in all different components. Capacity building from the institution, the funders, to understand that they should trust institution in the developing countries, and they should work with them based on the trust relationship, and build the capacity of the institution in the low and middle income to say that, okay, you need to grow, yes. So we trust you, but you have to show us that we can trust the work as you promise. And also at the same time, work with the Northern partners to tell them that, okay, we are trusting, we trust you, you also should trust others. So I think there are work that should be done at different level, not only in one institution, but each component needs to learn and to improve the way to work. I think that is what I can say.
Thank you.
Yeah, it's not my inclination or personality to step back, but if we're in partnership, right, and as my partner, he says to me, we need you to step back on this issue, then as a partner, and we're in a trusting relationship, I need to step back, right, because my partner is saying, for the partnership to succeed, this is what we need for you to do, and then I need to do what my partner is asking me to do.
Thank you. I believe if we were doing a word cloud, the words trust and learning would have been the two most, and maybe that's a great thing. Thank you both for your thoughts. Thank you, everybody, for your questions.
All right, our first poll.
So the first question is, what are the areas in which you feel you need more support to be a power shifting champion? So with the many conversations we've had today, what areas do you think you could use a lot of support to be that power shifting champion? Donor relations, that's good. Country ownership, great. Restructuring academic incentives. Control over budget. You're getting a lot of budget response, great. Country ownership again, great. Collaborating, very key, very key. Discussions with the traditional dollars. Is it traditional donors? Okay. Determining each partner's capacity. Creation of a network of folks like those here. I agree. Collaborating. Building equitable partnership. This is very key. Any more? Collaborating again. Financial independence, yeah.
How to shift power as a junior researcher.
Yeah, how to shift power as a junior researcher. That's like something we need to push forward. I agree. Maintaining and sustaining equitable partnership. Very key. Maintain, sustain.
Right.
All right.
So we'll go to the next poll.
What action will you prioritize as your next steps for your organization or institution? So it's okay if your position is as an individual, and would be great to also get the action as an institution. So yeah, listening, very key. So we need to listen more. Sharing back lessons from today, very, very important. Listening to community perspectives, mentoring young researchers, great. Persistence in support from leadership, very critical. Stepping back, I'm glad this is coming up. Listening to community perspectives, mentoring young researchers. Speaking up more, yeah, I agree. Learning from young researchers, very important. Reach out to potential partner in proposal development. Listening. Okay, yeah, prioritizing dissemination. That was really core for me because, yeah, a lot of investment needs to go into that in a cost-effective manner too. Trusting those closer to our beneficiaries, very important. Thank you for bringing that last thought. Where do you think we should have more of these power shifting conversations? Over the lunch break or coffee break, I met someone who was saying she's thinking of taking this conversation to the power shifting book club. So yeah, where do you think we should have more of these power shifting conversations?
Yeah, if there's a book club happening, we want to know about it. So we gotta share these resources.
Seems she's left the room, but yeah. Not at academic universities in Global South. Okay, great. That's like disclaimer. All right. Similar venues. So this could be like forums, conferences, meetings, whatever platforms you think. You could also be very specific. Not at academic university. Okay. With highest leadership, including boards of US organizations. I agree. Virtually to make it accessible to all. Yeah, this is very critical, and I think the next closing part would get that. Women deliver, IAPHS with government. With the people who are not in this room, emphasis on not, very important. Outside of these elite circles, I agree, with communities. media, yeah, with organization boards, yes, researchers in low and middle income countries, with, okay, I've gotten that. Okay, IUSSP, very important. Thank you for being specific there. Any more? All right, with PAA leadership, that's up there. UAP, do we mean UAPS? I'm not sure. UAP. Okay, thank you so much for this response, and it's really helpful to help us know where this should be moving to and the next steps, which I'll be inviting Kelly to come share with us. Thank you.
Okay. Let's try this. So we heard a lot of good things from our panelists, but also amongst the tables. There are a couple of key takeaways that I want to throw out there, making sure that they stick. We want to make sure that proximate actors play those essential roles within our ecosystems, from the design of research through the publication and dissemination of that information, and that the outcomes are mutually beneficial based on their actual needs. Going to the community as equals, bringing expertise and meeting each other's needs in that space, building trust through transparent, consistent behavior over time, which leads us to changing the way our projects are funded. So needing those sustainable resources of funding to keep these projects long enough to build that trust and to build really reliable long-term data, to keep in touch with the community through all the parts of the process, including the dissemination, and giving them access to that data, which is so important for them to be able to utilize. Equitable resource allocation to those partnerships across the partnership. So Althea was talking about splitting that funding equally, collective work to determine the methodologies, ensuring that the data analysis software licenses can be accessed by all partners, access to academic books and journals. All of those things are important to make sure that the partners are sharing in that power over that data that they're collecting. And the outcomes. Giving access to that data for all proximate partners and actors to be aware of where they can access that data, giving the difficult access through the National Bureau of Statistics, making sure that they have money if they have to pay for that access, not just to faculty, but to students as well. And ensuring that as priorities change for funders and politicians and those folks that are involved, that we are ensuring that the outcomes are mutually beneficial, not just to those funders and those politicians, but to those people in the local communities in which that data is being collected. And then increasing the funding for local partners for co-design, data analysis, scientific writing, training for the next generation of leaders in the field, and travel to academic conferences such as this to build those critical networks. How can we ensure that these power shifting conversations are having impact that lead to action, especially where we are coming from? So including health equity courses in the core curriculum at universities, encouraging our universities to do just that, to create those new competencies for future work. Must have those in power at the table when we're having these conversations. So it was great to have the dean here to kind of put a spotlight on some of the questions and concerns that folks in this room had, but also those in power, the funders that are there to also acknowledge and let us know how they're trying to change the system from within. Building more bridges with those local actors that are excited to get involved in the work. Thanks so much to Goodness for being a part of the ICFP power shifting, but also taking it forward into these other areas. And then hosting these conversations and conferences in general in those places that can be accessible to all of our partners, so that they can actually attend without visa issues and all of the things that we've realized are big challenges. And then learning to advocate and raise awareness for these issues. So there are smart advocacy programs out there that can give us those really nice tools to advocate for pushing this. And then last but not least, to seek to become those in power, that we can make those changes from those seats of power. So hopefully, those kinds of things we'll be able to take forward. Where do we go from here in this ICFP kind of power shifting conversation, or really power shifting community conversation? We really want to ensure that we are all recognizing that we don't have to make huge changes within the institutions and organizations in order to make an impact. So we can all look into what it is that we can do individually in both large and small ways. Recommending resources. So I know we talked about a reading group. We're going to, I think we have a link to the page on the ICFP community, Power Shifting Community site, where people will be able to send us their resources to post so that the entire community can have access to them and see what it is that you're reading, or webinars that have been broadcast. Check out and share those power shifting webinar recordings, serve on the power shifting subcommittees and different committees that not just through ICFP, but that are being formed at your universities, within your organizations. And then engaging with we're starting a community practice with implementing best practices, IBP. And so we'll be sending out information on how to join that community of practice to continue to push this conversation and action along these lines. And then the last thing is having your organizations and universities engage with not just this particular group, but other groups that are pushing for equity across our research with partners across the board. And the Research Fairness Initiative Forum is coming soon. I don't know, Anne, if you want to talk a little bit more about that.
So I don't know much about it. What I can say is that the Research Fairness Initiative is a resource that is based out of Geneva. Maybe somebody here knows more about it than I do. And they are producing materials, some of which were referred to earlier today, where they're trying to spec out different ways of conceptualizing research fairness and provide materials to support people who are implementing or attempting to implement greater research fairness in their practices. And they say that they're starting a way to share resources on that platform, but it's not active yet, and they seem to be non-responsive. So I don't know if folks here have more information than I do, but that's all I know. But the website in and of itself is a phenomenal resource, even without that part being active.
Thanks so much. And last thing I want to say is just a big thank you to our partners that we could really not have pulled this together without. So thanks to Jeff at PRB and Amelia, FHI 360 and Guttmacher. Just really much appreciated to you to be here, and goodness, thank you so much for joining us halfway across the world and being a part of this movement. So much appreciated. Thank you all for attending, and please do communicate with us and let us know what you'd like to see. I know we've talked about at the last power shifting pre-conference at ICFP, we talked about kind of accountability, ways to hold institutions and individuals and such accountable for the commitments that they make to power shifting and power sharing. So if there are ideas that you have or places that you'd like us to bring a conversation similar to this and subject matter that you'd like to host it around, please do let us know. So if you want to, I think most of you have already signed on to that community, that power shifting community, to be a part of that conversation. But if you haven't, please do, and we're looking forward to working with you in the future. Appreciate it.